In this video, I'm going to show you how to heal and repair your knee without surgery. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. So if you're dealing with a lot of knee pain right now due to an injury to the cartilage or soft tissues around the knee, and you're really worried about having surgery, definitely check this video out because I'm going to go over a two-part guide that's going to help improve blood flow and circulation to the knee, help lubricate it and improve mobility back into the joint, and help strengthen the main muscles, the ones that stabilize the knee. When you put all of this together, it's going to help repair and heal the knee without the need for surgery. Each one of these exercises works differently. To get the best results, go through them all and use what works best for you. Just a couple quick notes before we start. The first being, the first part is meant to be done at least 2 to 3 times throughout the day. Take one of the exercises or you can do both of those circulation exercises. Just make sure to keep circulation and mobility into the knee as much as you can throughout the day. In the second part, the strengthening exercises, aim to do them at least 3 to 4 times a week. You can take one exercise, you can do all the exercises, just do what you feel comfortable doing. Last, this will not be an immediate process. Knees take time to heal, but over the course of a couple weeks, hopefully you will see really good results. With that being said, let's get started. In the first part, we're going to focus on improving blood flow to the knee muscles and their tendons, and also improving circulation of synovial fluid to the knee joint. Think of that as the lubrication that your knee needs to help it keep moving. This is an extremely important first step because by improving circulation to the knee, we're going to help speed up the repair process to damage cartilage or any soft tissue in the knee. Here's a really easy exercise that we can do in bed or on a floor. Just lie flat on your back like this. You're going to have your legs roughly hip width apart, knees bent, feet flat. The first thing that I like to do is target the knee that feels like it has the most amount of pain or stiffness. Let's say it's our left side. What you're going to do is slowly straighten that knee out as much as you can while keeping your foot flat on the bed or the floor. Just build into this one, but don't go to the point of any pain or discomfort. If you can only bend it a little bit, hold it before that point just for a second or two and then slide it back towards your bottom, and then just repeat this on the other side. The goal is to open up your knee as much as you can to the point where it is straight. If you're able to do that, what you want to do is just focus on this movement nice and slowly for about 10 to 15 repetitions on both sides. If it feels like it's helping out though, you're more than welcome to throw in as many repetitions as you'd like. What you're focusing on doing is building a lot of warmth, that blood flow into the knees as much as possible. But if you would like to take this one to the next level and hopefully get some more results, we can add in a couple more movements. So what you want to do, again, is start with the most painful or tight side. Let's say that's our left side. You're going to straighten your knee out as much as you can. When you can't go any further, you're going to hold this and now take your foot and act like you're pressing into a gas pedal. So just press your foot away. As you do this, you're going to feel the muscles around the calves start to fire that works upward towards the knee. Really focus on feeling it into the knee. Hold this for a second or two and then bring your foot back towards you like this. So essentially what we're trying to do is pump our ankle away and forward like this. Just try to do this about 5 times in both directions. You can also do what is called a windshield wiper movement. So what I'm doing is taking my foot and going towards one side as much as I can until I feel the muscles and soft tissues activate around the knee. Generally when you go outside like this, you feel it a little bit more on the inner part of the knee, and then when you go inside like this, you'll feel it on the outer part of the knee. So again, just back and forth like this about 5 times, relax, and then you're just going to repeat it on the other side. I would try to do this whole cycle about 5 times on both sides. But if you do notice one position, like for me on the left, going inward like this, it just targets tightness or just feels like it's the weak link. At that point, I like to throw more repetitions in until everything feels like it's nice and loose, or I'm not getting any more improvement. So here's another really good circulation and mobility exercise that we can do seated. You just need a flat elevated surface, one high enough where your feet will not hit the floor. So the edge of a bed generally works perfectly. So let's start with the knee that feels like it has the most pain or discomfort. Let's say it's our right knee. What you're going to do is just simply straighten your knee as much as you can by lifting your foot upward towards the ceiling. but stop before the point of any pain or discomfort. Once you feel a really good activation into the knee, can't go any further with it, hold this for a couple seconds and then you're just going to relax, take a breather, and then you're just going to repeat this over and over again for at least 10 to 15 repetitions, focusing on feeling that warmth come into the knee, and it just feels like your knee is becoming more mobile with each repetition. So with this one, it's really going to help target the quadriceps, especially the quadriceps tendons that bridge right here into the knee, huge instigator of knee pain and issues. So once it feels like everything is nice and warmed up, let's take this one to the next level and focus on some more knee movements to hopefully get better results. So what I'd like to do this time around is turn my foot inward as much as I can until I feel a really good activation of the soft tissues around the knee. I really feel it on the outside of my knee with this one. And at that point, I'm now going to lift my foot upward. Again, just hits it a little bit differently. On the next repetition, I just turn my foot outward to activate a little bit more on the inner part of the knee, and then just repeat. Do this nice and slowly for at least 5 repetitions in both directions. But if you do notice that one position, like for me, turning it inward like this, it just hits the knee a little bit more, feels like that weak link. At that point, I like to throw more repetitions in until everything is nice and loose, like I can straighten my knee completely, or it just feels like I'm not getting any more improvement. And for good measure, I would throw a couple repetitions in on the other side, even if it doesn't feel like there's any problems, just to make sure that we keep everything in balance. In the second part, we're going to focus on strengthening exercises, which are extremely important for building stability around the knee, helping to take tension, pressure, and stress off the soft tissues, including the cartilage, so they can heal and repair much quicker. This first exercise we can do in bed or on a floor. Just lie flat on your back like this. Have your legs roughly hip-width apart, knees bent, feet flat. Whatever side that you're having knee pain, let's say it's your left side, just slowly straighten that knee out as much as you can. From here, you're going to lightly brace your core muscles. It's kind of like when somebody pokes you in your stomach, how you tense up, drawing your belly button towards your spine. Just lightly hold it during this exercise. It will help protect your lower back. And for good measure, I like to just lightly squeeze or clench my butt cheeks, the glutes, to activate those muscles, because they are extremely important for hip and knee stabilization. So after we've done all of that, what you're going to do is slowly raise this painful knee upward like this, so it's roughly in line with the other knee. If you're unable to get it all the way up, like you can only go up a little bit due to pain or discomfort, do the best you can. Hold this position for about 3 to 5 seconds, and then you're going to relax, take a breather, and then you're going to repeat this over and over again for 10 to 15 repetitions. And with each repetition, try to build into it just a little bit more. What this is going to do is help activate and strengthen the quadriceps muscles right here on the front of your thigh. These are essential for knee function and just overall stability. So what you're going to do, again, is just repeat this over and over again for about 10 repetitions. But if it feels like you have a little bit more energy, challenge yourself by throwing in another set or 2. And for good measure, I would do this on the other side just to make sure that we keep everything in balance. So let's take this one to the next level and focus on some more muscles that will help stabilize the knee, including the abductors and the glutes right here on the outside of our hip. So for this one, we're going to flip over on our side, and you want the most painful side towards the ceiling. So for demonstrative purposes, I'm going to show this on the right side because I have a microphone. So what you want to do is have your body in a nice straight line. You're going to have your knees bent roughly at 90 degrees, and you just want to swing them forward a little bit. From here, support your head with your hand just like this. What I'm going to do first is take this painful knee, and I'm just going to press it or wing it upward towards the ceiling as much as I can, really focusing on feeling the muscles around the hips start to fire. That would include the glutes. Once you feel that, hold this comfortably for about 3 to 5 seconds, and then you're going to slowly lower that knee back downward like this, resisting against your leg weight. So we're going to resist going up and down to target the muscles in both directions. I like to do this nice and slowly for about 10 repetitions in both directions. And with each repetition, just building into it a little bit more. Afterwards, see how you feel. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or two. But if you want to take this one to the next level and make it a little bit more challenging, what you can do is straighten this painful knee as much as you can. Hold that position and have your legs right here, your thighs in line with each other, and just slowly raise that foot upward towards the ceiling. You're going to have a lot more weight that's going to offer resistance. So again, it's a lot more challenging. So build into that one when you feel ready. Just make sure though, whatever you do on one side, always do on the other to help keep everything in balance. Here's a really good strengthening exercise that really doesn't require that much movement of the knee. For this one, all we're going to need is a rolled up towel. And just as a quick note, the larger the towel, the more challenging this would be. So start off with something small, progress into a larger towel when you feel ready. Let's break this one down. We're going to place that towel underneath our painful knee and just have our leg resting at the edge of a bed or on a floor. What you want to do is just slowly press the back of your knee downward into the towel, straightening it as much as you can. As you do this, you're going to feel a deep activation of the muscles right here on the top of the thigh, including the quadriceps, and their tendons right here as they travel into the knee. Build into this as much as you can and hold this comfortably for about 5 seconds. You're going to release it, and then with each repetition, try to build into it just a little bit more for 10 to 15 repetitions. Afterwards, see how you feel. If it feels like you have a little bit more energy, always challenge yourself by throwing in another set or two. And for good measure, I would switch legs and repeat, throw a couple repetitions in on the other knee, even if it doesn't hurt, just to help keep everything in balance. So this last strengthening exercise is definitely going to be the most challenging, but it's also going to literally strengthen all the muscles that help support our knees. This is called the wall sit or the wall squat, and all you're going to need is a smooth wall. So let's break this one down. What you're going to do is have your feet out in front of you. That way you can lean your whole backside flush against the wall. So you want from the back of your head, upper back, all the way down towards your butt, flush against that wall. I like to have my legs a little bit wider than my hips, and then from there I just point my toes out slightly to take tension off my knees. And let's try to place all of our body weight more towards the middle part of our foot onto our heels. Gives us a little bit better center of gravity. From here, let's just lightly brace our core muscles. Again, it's like somebody poking you in your stomach, how you tense up. Draw your belly button towards your spine, protect your back, and let's really focus on clenching or squeezing our butt cheeks with this one to target those glutes. So once we've done all of that, it's really, really straightforward. What you're going to do is just squat or sit downward as much as you can. The further that you go down, the more that you're going to feel a deep activation around the glutes, around your hips, into your thighs towards the knees. Once you feel it in the knees and it's not causing any pain or discomfort, if you do feel that, back off slightly. You want to hold this for about 3 to 5 seconds and then stand back up, take a breather. Repeat this nice and slowly for about 10 to 15 repetitions, and with each repetition, challenge yourself to go down a little bit further. Afterwards, see how you feel. If it feels like you have a little bit more energy, challenge yourself by throwing in another set or two. So let's take this one to the next level and focus a little bit more below the knee by doing what are called eccentric calf raisers. We're going to need our wall again for this. So what I'm going to do is start close to that wall, face it, and I'm going to place all of my body weight onto the balls of my feet. And my feet are roughly about hip width apart. You can use your hands on the wall too for support if needed. But what you want to do is just simply raise your heels upward towards the ceiling as much as you can. The more that you press up, the more that you're going to feel a deep activation into the calf muscles that works towards your knees. Once you feel it in the knees, you want to hold this for 3 to 5 seconds and then slowly lower your heels back towards the floor, resisting against your body weight. So we're going to resist going up and down to target the muscles in both directions. I would do this nice and slowly for about about 10 to 15 repetitions. But if it feels like you have a little bit more energy, again, challenge yourself by throwing in another set or two. But if you really want to take this one to the next level, you can do what are called eccentric calf raisers. So this time around, instead of going straight up like this, lean your body weight a little bit off to one side, like I'm going towards my right, and then I'm going to lift up, come back to the center, swing over towards my left, and then finally lower back down, kind of like creating a big circle with your heels. When you do this, you're going to feel that the muscles and the knee gets hit just a little bit differently. So I would try to do one direction about 5 times and then switch it up in the opposite direction and then repeat. When you do this, you're probably going to find that one certain position just feels like it's really, really weak or more challenging. Maybe you have a lot of tightness there. For me, it's when I go off to my right. At that point, I treat it like a weak link and I keep building into that movement over and over again until it feels like I got a really good workout or until everything loosens up. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.